Hello everyone, and welcome back to the channel. If you watched video number 1, we discussed the general approach to abdominal pain, including SOCRATES, red flags, and common causes of abdominal pain. Today, in video number 2, we're going to focus on one very important cause of right upper abdominal pain: acute cholecystitis. By the end of this video, you will know what acute cholecystitis is, how to take a history, how to summarize the case, important differential diagnoses, physical examination findings, laboratory investigations, imaging studies, how to confirm the diagnosis, and the key high-yield exam points that frequently appear in CAMC, MCCQE, USMLE, PLAB, and OSCE exams. Let's begin. What is acute cholecystitis? Acute cholecystitis is inflammation of the gallbladder. In most cases, it happens because a gallstone blocks the cystic duct. The trapped bile causes inflammation, swelling, and eventually infection. This is why patients become sick and develop fever. Now let's learn how to take the history. Whenever a patient presents with abdominal pain, remember SOCRATES. Let's go through each part. Cite. Ask. Can you point with one finger to where the pain is? In acute cholecystitis, the pain is usually located in the right upper quadrant of the abdomen. The patient often points just below the right rib cage. Onset. Ask. When did the pain start? Patients commonly say, "It started several hours ago." The pain often begins after eating a fatty meal. For example, pizza, fried chicken, hamburgers, French fries. Character. Ask. What does the pain feel like? Patients often describe the pain as steady, aching, constant. Unlike biliary colic, the pain does not come and go. Radiation. Ask. Does the pain move anywhere? The pain may radiate to the right shoulder, the right upper back. This is a classic clue. Associated symptoms. This is extremely important. Ask. Do you have fever? Do you have nausea? Have you vomited? Have you lost your appetite? Many patients answer yes to these questions. Timing. Ask. Is the pain constant or does it come and go? In acute cholecystitis, the pain is usually constant. It commonly lasts longer than 6 hours. Exacerbating factors. Ask. What makes the pain worse? Common answers include fatty foods, movement, deep breathing, severity. Ask. On a scale from 0 to 10, how severe is the pain? Most patients describe the pain as 6 to 8 out of 10. Now let's talk about important background questions. Past medical history. Ask about previous gallstones, previous similar attacks, diabetes, obesity, high cholesterol, liver disease, recent rapid weight loss. Family history. Ask if anyone in the family has gallstones, gallbladder disease, high cholesterol, obesity. Social history. Ask about diet, fatty food intake, smoking, alcohol use, recent weight changes, pregnancy. Now let's imagine we have finished the history. How do we summarize the case to the patient? A good summary might sound like this. Thank you for answering my questions. You have pain in the right upper part of your abdomen that started after eating and spreads to your shoulder and back. You also have fever, nausea, and vomiting. One possible cause is inflammation of the gallbladder called acute cholecystitis. We will perform some tests to confirm the diagnosis. Now let's discuss the differential diagnosis. Never jump to one diagnosis immediately. Always think of other possibilities. The main differential diagnoses include acute cholecystitis, biliary colic, pancreatitis, hepatitis, peptic ulcer disease, right lower lobe pneumonia, liver abscess. These conditions can present with similar symptoms. Next comes the physical examination. General examination. Look at the patient. Do they appear uncomfortable? Do they have fever? Are they sweating? Do they look ill? Now examine the abdomen. The most important finding is right upper quadrant tenderness. The patient experiences pain when you press over the gallbladder area. The most famous sign is Murphy's sign. To perform Murphy's sign, Place your hand in the right upper abdomen. Ask the patient to take a deep breath. If the patient suddenly stops breathing because of pain, the test is positive. A positive Murphy sign is one of the classic findings of acute cholecystitis. Now let's move to laboratory investigations. CBC. This often shows an elevated white blood cell count. This tells us inflammation or infection may be present. CRP. CRP is usually elevated. This is another marker of inflammation. Liver function tests. We commonly order AST, ALT, ALP, GGT. These may be mildly elevated. Bilirubin. Bilirubin may be elevated if a gallstone blocks the bile duct. Lipase. Always check lipase. This helps rule out pancreatitis. Now let's discuss imaging. The best first imaging study is a right upper quadrant ultrasound. This is the investigation of choice. Ultrasound may show gallstones, thickened gallbladder wall, fluid around the gallbladder, an enlarged gallbladder. These findings strongly support acute cholecystitis. If the ultrasound is unclear, the next investigation may be a HIDA scan. A HIDA scan evaluates whether the gallbladder is functioning properly. Sometimes a CT scan of the abdomen may be performed, although it is not usually the first choice. Now let's discuss how we confirm the diagnosis. The diagnosis of acute cholecystitis is confirmed using both clinical findings and imaging findings. Clinical findings include right upper quadrant pain, fever, positive Murphy sign. Ultrasound findings include gallstones, gallbladder wall thickening, pericocystic fluid. When these findings occur together, the diagnosis becomes very likely. Now let's review the key high-yield findings. History: right upper quadrant pain, pain after fatty meals, pain radiating to the right shoulder, fever, nausea, vomiting, physical examination, positive Murphy sign, laboratory tests, elevated white blood cell count, elevated CRP, imaging, gallstones, inflamed gallbladder, gallbladder wall thickening, pericholocystic fluid. Now let's discuss a very important exam question. How do we differentiate biliary colic from acute cholecystitis? This is asked very frequently. Biliary colic, no fever, normal white blood cell count. Pain comes and goes. Pain usually lasts less than 6 hours. Murphy sign is negative. The gallbladder is not infected. Acute cholecystitis. Fever is present. White blood cell count is elevated. Pain is constant. Pain lasts more than 6 hours. Murphy sign is positive. The gallbladder is inflamed and infected. Here's the simplest exam clue to remember. Gallstones plus right upper quadrant pain plus no fever equals biliary colic. Gallstones plus right upper quadrant pain plus fever equals acute cholecystitis. Before we finish, let's review the one-line diagnosis. A patient with constant right upper quadrant pain after a fatty meal, fever, nausea, vomiting, and a positive Murphy sign is highly suggestive of acute cholecystitis. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to the channel. It really helps support the channel and allows me to create more free medical education content. Leave a comment below and tell me which abdominal pain diagnosis you would like me to cover next. Good luck with your studies. Keep learning, keep improving, and I'll see you in video number 3.